NCLEX-PN Review Questions 155. Question 1. Which classification of drugs is contraindicated for the client with hypertrophic cardiomyopathy? Here are the options. Option A. Positive inotropes. Option B. Vasodilators. Option C. Diuretics. Option D. Antidysrhythmics. The correct answer is option A. Positive inotropes. The correct answer is positive inotropes. Positive inotropic agents should not be administered owing to their action of increasing myocardial contractility. Increased ventricular contractility would increase outflow tract obstruction in the client with hypertrophic cardiomyopathy. Question 2. Signs and symptoms of an allergy attack include which of the following? Here are the options. Option A. Wheezing on inspiration. Option B. Increased respiratory rate. Option C. Circumoral cyanosis. Option D. Prolonged expiration. The correct answer is option D. Prolonged expiration. The correct answer is prolonged expiration. Expiration is prolonged because the alveoli are greatly distended and air trapping occurs. Question 3. A client confides to the nurse that he tasted poison in his evening meal. This would be an example of what type of hallucination? Here are the options. Option A. Auditory. Option B. Gustatory. Option C. Olfactory. Option D. Visceral. The correct answer is option B. Gustatory. The correct answer is gustatory. Gustatory hallucinations involve a sensory perceptions of taste. Question 4. Which of the following findings would be abnormal in a postpartum woman? Here are the options. Option A. Chills shortly after delivery. Option B. Pulse rate of 60 beats per minute in morning on first post-delivery day. Option C. Urinary output of 3,000 milliliters on the second day after delivery. Option D. An oral temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius on the third day after delivery. The correct answer is option D. An oral temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius on the third day after delivery. The correct answer is an oral temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius on the third day after delivery. A temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius may occur after delivery as a result of exertion and dehydration of labor. However, any temperature greater than 100.4 degrees Fahrenheit needs further investigation to identify any infectious process. Question 5. A 6-month-old infant has been admitted to the emergency room with febrile seizures. In the teaching of the parents, the nurse states that, here are the options. Option A. Sustained temperature elevation over 103 degrees Fahrenheit is generally related to febrile seizures. Option B. Febrile seizures do not usually recur. Option C. There is little risk of neurological deficit and mental retardation as sequelae to febrile seizures. Option D. Febrile seizures are associated with diseases of the central nervous system. The correct answer is option C. There is little risk of neurological deficit and mental retardation as sequelae to febrile seizures. The correct answer is there is little risk of neurological deficit and mental retardation as sequelae to febrile seizures. There is little risk of neurological deficit, mental retardation, or altered behavior secondary to febrile seizures. Question 6. A client diagnosed with bipolar disorder continues to be hyperactive and to lose weight. Which of the following nutritional interventions would be most therapeutic for him at this time? Here are the options. Option A. Small, frequent feedings of foods that can be carried. Option B. Tube feedings with nutritional supplements. Option C. Allowing him to eat when and what he wants. Option D. Giving him a quiet place where he can sit down to eat meals. The correct answer is option A. Small, frequent feedings of foods that can be carried. The correct answer is small, frequent feedings of foods that can be carried. The manic client is unable to sit still long enough to eat an adequate meal. Small, frequent feedings with finger foods allow him to eat during periods of activity. Question 7. A client with bipolar disorder taking lithium tells the nurse that he has ringing in his ears, blurred vision, and diarrhea. The nurse notices a slight tremor in his left hand and a slurring pattern to his speech. Which of the following actions by the nurse is appropriate? Here are the options. Option A. Administer immediately dose of lithium as necessary. Option B. Recognize this as an expected response to lithium. Option C. Request an order for immediately blood lithium level. Option D. Give an oral dose of lithium antidote. The correct answer is option C. Request an order for immediately blood lithium level. The correct answer is request an order for immediately blood lithium level. The client is exhibiting symptoms of lithium toxicity which may be validated by lab studies. Question 8. A diagnosis of hepatitis C is confirmed by a male client's physician. The nurse should be knowledgeable of the differences between hepatitis A, B, and C. Which of the following are characteristics of hepatitis C? Here are the options. Option A. The potential for chronic liver disease is minimal. Option B. The onset of symptoms is abrupt. Option C. The incubation period is 2 to 26 weeks. Option D. There is an effective vaccine for hepatitis B, but not for hepatitis C. The correct answer is option C. The incubation period is 2 to 26 weeks. The correct answer is the incubation period is 2 to 26 weeks. Incubation periods are as follows. Hepatitis C is 2 to 26 weeks. Hepatitis B is 6 to 20 weeks, and hepatitis A is 2 to 6 weeks. Question 9. Hypoxia is the primary problem related to near-drowning victims. The first organ that sustains irreversible damage after submersion in water is the... Here are the options. Option A. Kidney urinary system. Option B. Brain nervous system. Option C. Heart circulatory system. Option D. Lungs respiratory system. The correct answer is option B. Brain nervous system. The correct answer is brain nervous system. The cerebral neurons sustain irreversible damage after 4 to 6 minutes of water submersion. Question 10. Which of the following activities would be most appropriate during occupational therapy for a client with bipolar disorder? Here are the options. Option A. Playing cards with other clients. Option B. Working crossword puzzles. Option C. Playing tennis with a staff member. Option D. Sewing beads on a leather belt. The correct answer is option C. Playing tennis with a staff member. The correct answer is playing tennis with a staff member. This activity uses gross motor skills, eases tension, and expands excess energy. A staff member is better equipped to interact therapeutically with clients. Question 11. A 30-year-old male client is admitted to the psychiatric unit with a diagnosis of bipolar disorder. For the last 2 months, his family describes him as being on the move, sleeping 3 to 4 hours nightly, spending lots of money, and losing approximately 10 pounds. During the initial assessment with the client, the nurse would expect him to exhibit which of the following? Here are the options. Option A. Short, polite responses to interview questions. Option B. Introspection related to his present situation. Option C. Exaggerated self-importance. Option D. Feelings of helplessness and hopelessness. The correct answer is option C. Exaggerated self-importance. The correct answer is exaggerated self-importance. Grandiosity and an inflated sense of self-worth are characteristic of this disorder. Question 12. Diabetes during pregnancy requires tight metabolic control of glucose levels to prevent perinatal mortality. When evaluating the pregnant client, the nurse knows the recommended serum glucose range during pregnancy is. Here are the options. Option A. 70 mg per deciliter and 120 mg per deciliter. Option B. 100 mg per deciliter and 200 mg per deciliter. Option C. 40 mg per deciliter and 130 mg per deciliter. Option D. 90 mg per deciliter and 200 mg per deciliter. The correct answer is option A. 70 mg per deciliter and 120 mg per deciliter. The correct answer is 70 mg per deciliter and 120 mg per deciliter. The recommended range is 70 to 120 mg per deciliter to reduce the risk of perinatal mortality. Question 13. A 55-year-old man is admitted to the hospital with complaints of fatigue, jaundice, anorexia, and clay-colored stools. His admitting diagnosis is rule out hepatitis. Laboratory studies reveal elevated liver enzymes and bilirubin. In obtaining his health history, the nurse should assess his potential for exposure to hepatitis. Which of the following represents a high-risk group for contracting this disease? Here are the options. Option A. Heterosexual males. Option B. Oncology nurses. Option C. American Indians. Option D. Jehovah's Witnesses. The correct answer is option B. Oncology nurses. The correct answer is oncology nurses. Oncology nurses are employed in high-risk areas and perform invasive procedures that expose them to potential sources of infection. Question 14. When evaluating a client with symptoms of shock, it is important for the nurse to differentiate between neurogenic and hypovolemic shock. The symptoms of neurogenic shock differ from hypovolemic shock in that. Here are the options. Option A. In neurogenic shock, the skin is warm and dry. Option B. In hypovolemic shock, there is a bradycardia. Option C. In hypovolemic shock, capillary refill is less than 2 seconds. Option D. In neurogenic shock, there is delayed capillary refill. The correct answer is option A. In neurogenic shock, the skin is warm and dry. The correct answer is in neurogenic shock, the skin is warm and dry. Neurogenic shock is caused by injury to the cervical region, which leads to loss of sympathetic control. This loss leads to vasodilation of the vascular beds, bradycardia resulting from the lack of sympathetic balance to parasympathetic stimuli from the vagus nerve, and the loss of the ability to sweat below the level of injury. In neurogenic shock, the client is hypotensive but bradycardiac with warm, dry skin. Question 15. A schizophrenic client has made sexual overtures toward her physician on numerous occasions. During lunch, the client tells the nurse, "My doctor is in love with me and wants to marry me." This client is using which of the following defense mechanisms? Here are the options. Option A, displacement. Option B, projection. Option C, reaction formation. Option D, suppression. The correct answer is option B, projection. The correct answer is projection. Projection involves attributing one's thoughts or feelings to another person. Question 16. In a client with chest trauma, the nurse needs to evaluate mediastinal position. This can best be done by, here are the options. Option A, auscultating bilateral breath sounds. Option B, palpating for presence of crepitus. Option C, palpating for tracheal deviation. Option D, auscultating heart sounds. The correct answer is option C, palpating for tracheal deviation. The correct answer is palpating for tracheal deviation. Mediastinal shift occurs primarily with tension pneumothorax, but it can occur with very large hemothorax or pneumothorax. Mediastinal shift causes tracheal deviation and deviation of the heart's point of maximum impulse. Question 17. When teaching a sex education class, the nurse identifies the most common sexually transmitted diseases in the United States as, here are the options. Option A, chlamydia. Option B, herpes genitalis. Option C, syphilis. Option D, gonorrhea. The correct answer is option A, chlamydia. The correct answer is chlamydia. Chlamydia trachomatis infection is the most common sexually transmitted disease in the United States. The Centers for Disease Control and Prevention recommends screening of all high-risk women, such as adolescents and women with multiple sex partners. Question 18. The nurse assists a client with advanced emphysema to the bathroom. The client becomes extremely short of breath while returning to bed. The nurse should, here are the options. Option A, increase his nasal oxygen to 6 liters per minute. Option B, place him in a lateral Sims position. Option C, encourage pursed lip breathing. Option D, have him breathe into a paper bag. The correct answer is option C, encourage pursed lip breathing. The correct answer is encourage pursed lip breathing. Pursed lip breathing helps the client to blow off carbon dioxide and to keep air passages open. Question 19. Clinical manifestations seen in left-sided rather than in right-sided heart failure are, here are the options. Option A, elevated central venous pressure and peripheral edema. Option B, dyspnea and jaundice. Option C, hypotension and hepatomegaly. Option D, decreased peripheral perfusion and rales. The correct answer is option D, decreased peripheral perfusion and rales. The correct answer is decreased peripheral perfusion and rales. Clinical manifestations of left-sided heart failure are left ventricular dysfunction, decreased cardiac output, hypotension, and a backward failure as a result of increased left atrium and pulmonary artery pressures, pulmonary edema, and rales. Question 20. In assessing cardiovascular clients with progression of aortic stenosis, the nurse should be aware that there is typically, here are the options. Option A. Decreased pulmonary blood flow and cyanosis. Option B. Increased pressure in the pulmonary veins and pulmonary edema. Option C. Systemic venous engorgement. Option D. Increased left ventricular systolic pressures and hypertrophy. The correct answer is option D. Increased left ventricular systolic pressures and hypertrophy. The correct answer is increased left ventricular systolic pressures and hypertrophy. Left ventricular hypertrophy occurs to increase muscle mass and overcome the stenosis. Left ventricular pressures increase as left ventricular volume increases owing to insufficient emptying. Question 21. An 8-year-old child comes to the physician's office complaining of swelling and pain in the knees. His mother says, the swelling occurred for no reason and it keeps getting worse. The initial diagnosis is Lyme disease. When talking to the mother and child, questions related to which of the following would be important to include in the initial history. Here are the options. Option A. A decreased urinary output and flank pain. Option B. A fever of over 103 degrees Fahrenheit occurring over the last 2 to 3 weeks. Option C. Rashes covering the palms of the hands and the soles of the feet. Option D. Headaches, malaise, or sore throat. The correct answer is option D. Headaches, malaise, or sore throat. The correct answer is headaches, malaise, or sore throat. Classic symptoms of Lyme disease include headache, malaise, fatigue, anorexia, stiff neck, generalized lymphadenopathy, splenomegaly, conjunctivitis, sore throat, abdominal pain, and cough. Question 22. When administering phenytoin, dilantin to a child, the nurse should be aware that a toxic effect of phenytoin therapy is. Here are the options. Option A. Stevens-Johnson syndrome. Option B. Folate deficiency. Option C. Leukopenic-aplastic anemia. Option D. Granulocytosis and nephrosis. The correct answer is option A. Stevens-Johnson syndrome. The correct answer is Stevens-Johnson syndrome. Stevens-Johnson syndrome is a toxic effect of phenytoin. Question 23. The nurse should know that according to current thinking, the most important prognostic factor for a client with breast cancer is. Here are the options. Option A. Tumor size. Option B. Axillary node status. Option C. Client's previous history of disease. Option D. Client's level of estrogen progesterone receptor assays. The correct answer is option B. Axillary node status. The correct answer is axillary node status. Axillary node status is the most important indicator for predicting how far the cancer has spread. If the lymph nodes are positive for cancer cells, the prognosis is poorer. Question 24. 3 weeks following discharge, a male client is readmitted to the psychiatric unit for depression. His wife stated that he had threatened to kill himself with a handgun. As the nurse admits him to the unit, he says, "I wish I were dead because I am worthless to everyone. I guess I am just no good." Which response by the nurse is most appropriate at this time? Here are the options. Option A. I don't think you are worthless. I'm glad to see you, and we will help you. Option B. Don't you think this is a sign of your illness? Option C. I know with your wife and new baby that you do have a lot to live for. Option D. You've been feeling sad and alone for some time now. The correct answer is option D. You've been feeling sad and alone for some time now. The correct answer is you've been feeling sad and alone for some time now. This acknowledges the client's implied thoughts and feelings and encourages a response. Question 25. Which of the following should be included in discharge teaching for a client with hepatitis C? Here are the options. Option A. He should take aspirin as needed for muscle and joint pain. Option B. He may become a blood donor when his liver enzymes return to normal. Option C. He should avoid alcoholic beverages during his recovery period. Option D. He should use disposable dishes for eating and drinking. The correct answer is option C. He should avoid alcoholic beverages during his recovery period. The correct answer is he should avoid alcoholic beverages during his recovery period. Alcohol is detoxified in the liver. Question 26. The initial treatment for a client with a liquid chemical burn injury is to. Here are the options. Option A. Irrigate the area with neutralizing solutions. Option B. Flush the exposed area with large amounts of water. Option C. Inject calcium chloride into the burned area. Option D. Apply lanolin ointment to the area. The correct answer is option B. Flush the exposed area with large amounts of water. The correct answer is flush the exposed area with large amounts of water. The use of large amounts of water to flush the area is recommended for chemical burns. Question 27. Dietary planning is an essential part of the diabetic client's regimen. The American Diabetes Association recommends which of the following caloric guidelines for daily meal planning? Here are the options. Option A. 50% complex carbohydrate, 20% 25% protein, 20% 25% fat. Option B. 45% complex carbohydrate, 25% 30% protein, 30% 35% fat. Option C. 70% complex carbohydrate, 20% 30% protein, 10% 20% fat. Option D. 60% complex carbohydrate, 12% 15% protein, 20% 25% fat. The correct answer is option D. 60% complex carbohydrate, 12% 15% protein, 20% 25% fat. The correct answer is 60% complex carbohydrate, 12% 15% protein, 20% 25% fat. This combination provides enough carbohydrates to maintain blood glucose levels, enough protein to maintain body repair, and enough fat to ensure palatability. Question 28. The primary reason for sending a burn client home with a pressure garment, such as a jobst garment, is that the garment, here are the options. Option A. Decreases hypertrophic scar formation. Option B. Assists with ambulation. Option C. Covers burn scars and decreases the psychological impact during recovery. Option D. Increases venous return and cardiac output by normalizing fluid status. The correct answer is option A. Decreases hypertrophic scar formation. The correct answer is decreases hypertrophic scar formation. Tubular support, such as that received with a jobbed garment, applies tension of 10 to 20 millimeters of mercury. This amount of uniform pressure is necessary to prevent or reduce hypertrophic scarring. Clients typically wear a pressure garment for 6 to 12 months during the recovery phase of their care. Question 29. The nurse would expect to include which of the following when planning the management of the client with Lyme disease? Here are the options. Option A. Complete bed rest for 6 to 8 weeks. Option B. Tetracycline treatment. Option C. Intravenous amphotericin B. Option D. High-protein diet with limited fluids. The correct answer is option B. Tetracycline treatment. The correct answer is tetracycline treatment. Tetracycline is the treatment of choice for children with Lyme disease who are over the age of 9. Question 30. The physician recommends immediate hospital admission for a client with pregnancy-induced hypertension. She says to the nurse, "It's not so easy for me to just go right to the hospital like that." After acknowledging her feelings, which of these approaches by the nurse would probably be best? Here are the options. Option A. Stress to the client that her husband would want her to do what is best for her health. Option B. Explore with the client her perceptions of why she is unable to go to the hospital. Option C. Repeat the physician's reasons for advising immediate hospitalization. Option D. Explain to the client that she is ultimately responsible for her own welfare and that of her baby. The correct answer is option B. Explore with the client her perceptions of why she is unable to go to the hospital. The correct answer is explore with the client her perceptions of why she is unable to go to the hospital. The nurse should explore potential reasons for the client's anxiety. Are there small children at home? Is the husband out of town? The nurse should aid the client in seeking support or interventions to decrease the anxiety of hospitalization. Question 31. The child with iron poisoning is given intravenous deferoxamine mesylate disferal. Following administration, the child suffers hypotension, facial flushing, and urticaria. The initial nursing intervention would be to, here are the options. Option A. Discontinue the intravenous. Option B. Stop the medication and begin a normal saline infusion. Option C. Take all vital signs and report to the physician. Option D. Assess urinary output, and if it is 30 milliliters an hour, maintain current treatment. The correct answer is option B. Stop the medication and begin a normal saline infusion. The correct answer is stop the medication and begin a normal saline infusion. Stop the medication and begin a normal saline infusion. The child is exhibiting signs of an allergic reaction and could go into shock if the medication is not stopped. The line should be kept open for other medication. Question 32. Provide the 1-minute EPGAR score for an infant born with the following findings. Heart rate, above 100, respiratory effort, slow, irregular muscle tone, some flexion of extremities, reflex irritability, vigorous cry, color, body pink, blue extremities. Here are the options. Option A, 7. Option B, 10. Option C, 8. Option D, 9. The correct answer is option A, 7. The correct answer is 7. 7 out of a possible perfect score of 10 is correct. 2 points are given for heart rate above 100. 1 point is given for slow, irregular respiratory effort. 1 point is given for some flexion of extremities in assessing muscle tone. 2 points are given for vigorous cry in assessing reflex irritability. 1 point is assessed for color when the body is pink with blue extremities, acrocinosis. Question 33. A client has been diagnosed as being preeclamptic. The physician orders magnesium sulfate. Magnesium sulfate. Magnesium sulfate is used in the management of preeclampsia for. Here are the options. Option A. Prevention of seizures. Option B. Prevention of uterine contractions. Option C. Sedation. Option D. Fetal lung protection. The correct answer is option A. Prevention of seizures. The correct answer is prevention of seizures. Magnesium sulfate is classified as an anticonvulsant drug. In preeclampsia management, magnesium sulfate is used for prevention of seizures. Question 34. In the client with a diagnosis of coronary artery disease, the nurse would anticipate the complication of bradycardia with occlusion of which coronary artery? Here are the options. Option A. Right coronary artery. Option B. Left main coronary artery. Option C. Circumflex coronary artery. Option D. Left anterior descending coronary artery. The correct answer is option A. Right coronary artery. The correct answer is right coronary artery. Sinus bradycardia and atrioventricular heart block are usually a result of right coronary artery occlusion. The right coronary artery perfuses the sinoatrial and atrioventricular nodes in most individuals. Question 35. When the nurse is evaluating lab data for a client 18 to 24 hours after a major thermal burn, the expected physiological changes would include which of the following? Here are the options. Option A. Elevated serum sodium. Option B. Elevated serum calcium. Option C. Elevated serum protein. Option D. Elevated hematocrit. The correct answer is option D. Elevated hematocrit. The correct answer is elevated hematocrit. Hematocrit level is elevated owing to hemoconcentration from hypovolemia. Anemia is present in the post-burn stage owing to blood loss and hemolysis, but it cannot be assessed until the client is adequately hydrated. Question 36. What is the most effective method to identify early breast cancer lumps? Here are the options. Option A. Mammograms every 3 years. Option B. Yearly checkups performed by physician. Option C. Ultrasounds every 3 years. Option D. Monthly breast self-examination. The correct answer is option D. Monthly breast self-examination. The correct answer is monthly breast self-examination. Monthly breast self-examination has been shown to be the most effective method for early detection of breast cancer. Approximately 95% of lumps are detected by women themselves. Question 37. A client with a cervical 3 and 4 fracture has just arrived in the emergency room. The primary nursing intervention is. Here are the options. Option A. Stabilization of the cervical spine. Option B. Airway assessment and stabilization. Option C. Confirmation of spinal cord injury. Option D. Normalization of intravascular volume. The correct answer is option B. Airway assessment and stabilization. The correct answer is airway assessment and stabilization. Primary intervention is protection of the airway and adequate ventilation. Question 38. To ensure proper client education, the nurse should teach the client taking sublingual nitroglycerin to expect which of the following responses with administration. Here are the options. Option A. Stinging, burning when placed under the tongue. Option B. Temporary blurring of vision. Option C. Generalized urticaria with prolonged use. Option D. Urinary frequency. The correct answer is option A. Stinging, burning when placed under the tongue. The correct answer is stinging, burning when placed under the tongue. Stinging or burning when nitroglycerin is placed under the tongue is to be expected. This effect indicates that the medication is potent and effective for use. Failure to have this response means that the client needs to get a new bottle of nitroglycerin. Question 39. Nursing care for the substance abuse client experiencing alcohol withdrawal delirium includes. Here are the options. Option A. Maintaining seizure precautions. Option B. Restricting fluid intake. Option C. Increasing sensory stimuli. Option D. Applying ankle and wrist restraints. The correct answer is option A. Maintaining seizure precautions. The correct answer is maintaining seizure precautions. These clients are at high risk for seizures during the first week after cessation of alcohol intake. Question 40. The day following his admission, the nurse sits down by a male client on the sofa in the day room. He was admitted for depression and thoughts of suicide. He looks at the nurse and says, "My life is so bad no one can do anything to help me." The most helpful initial response by the nurse would be, here are the options. Option A. It concerns me that you feel so badly when you have so many positive things in your life. Option B. It will take a few weeks for you to feel better, so you need to be patient. Option C. You are telling me that you are feeling hopeless at this point? Option D. Let's play cards with some of the other clients to get your mind off your problems for now. The correct answer is option C. You are telling me that you are feeling hopeless at this point? The correct answer is you are telling me that you are feeling hopeless at this point? This response acknowledges the client's feelings and invites a response. Question 41. The usual treatment for diabetes insipidus is with intramuscular or subcutaneous injection of vasopressin tannate in oil. Nursing care related to the client receiving intramuscular vasopressin tannate would include. Here are the options. Option A. Weigh once a week and report to the physician any weight gain of 10 pounds. Option B. Limit fluid intake to 500 milliliters per day. Option C. Store the medication in a refrigerator and allow to stand at room temperature for 30 minutes prior to administration. Option D. Hold the vial under warm water for 10 to 15 minutes and shake vigorously before drawing medication into the syringe. The correct answer is option D. Hold the vial under warm water for 10 to 15 minutes and shake vigorously before drawing medication into the syringe. The correct answer is hold the vial under warm water for 10 to 15 minutes and shake vigorously before drawing medication into the syringe. Holding the vial under warm water for 10 to 15 minutes or rolling between your hands and shaking vigorously before drawing medication into the syringe activates the medication in the oil solution. Question 42. Proper positioning for the child who is in Brian's traction is. Here are the options. Option A. Both hips flexed at a 90-degree angle with the knees extended and the buttocks elevated off the bed. Option B. Both legs extended and the hips are not flexed. Option C. The affected leg extended with slight hip flexion. Option D. Both hips and knees maintained at a 90-degree flexion angle, and the back flat on the bed. The correct answer is option A. Both hips flexed at a 90-degree angle with the knees extended and the buttocks elevated off the bed. The correct answer is both hips flexed at a 90-degree angle with the knees extended and the buttocks elevated off the bed. The child's weight supplies the countertraction for Bryant's traction. The buttocks are slightly elevated off the bed, and the hips are flexed at a 90-degree angle. Both legs are suspended by skin traction. Question 43. Hematotympanometapneumonia and otorrhea are associated with which of the following head injuries? Here are the options. Option A. Basilar skull fracture. Option B. Subdural hematoma. Option C. Epidural hematoma. Option D. Frontal lobe fracture. The correct answer is option A. Basilar skull fracture. The correct answer is basilar skull fracture. Basilar skull fractures are fractures of the base of the skull. Blood behind the eardrum or blood or cerebrospinal fluid leaking from the ear are indicative of a dural laceration. Basilar skull fractures are the only type with these symptoms. Question 44. Which of the following risk factors associated with breast cancer would a nurse consider most significant in a client's history? Here are the options. Option A. Menarche after age 13. Option B. Nulliparity. Option C. Maternal family history of breast cancer. Option D. Early menopause. The correct answer is option C. Maternal family history of breast cancer. The correct answer is maternal family history of breast cancer. A positive family history puts a woman at an increased risk of developing breast cancer. It is recommended that mammography screening begin 5 years before the age at which an immediate female relative was diagnosed with breast cancer. Question 45. The priority nursing goal when working with an autistic child is. Here are the options. Option A. To establish trust with a child. Option B. To maintain communication with the family. Option C. To promote involvement in school activities. Option D. To maintain nutritional requirements. The correct answer is option A. To establish trust with the child. The correct answer is to establish trust with the child. The priority nursing goal when working with an autistic child is establishing a trusting relationship. Question 46. The nurse would need to monitor the serum glucose levels of a client receiving which of the following medications, owing to its effects on glycogenolysis and insulin release? Here are the options. Option A. Norepinephrine Levoft. Option B. Dobutamine Dobotrax. Option C. Propranolol Inderal. Option D. Epinephrine Adrenaline. The correct answer is option D. Epinephrine Adrenaline. The correct answer is epinephrine Adrenaline. Epinephrine increases serum glucose levels by increasing glycogenolysis and inhibiting insulin release. Prolonged use can elevate serum lactate levels, leading to metabolic acidosis, increased urinary catecholamines, false elevation of blood urea nitrogen, and decreased coagulation time. Question 47. When a client questions the nurse as to the purpose of exercise electrocardiography in the diagnosis of cardiovascular disorders, the nurse's response should be based on the fact that, here are the options. Option A. The test provides a baseline for further tests. Option B. The procedure simulates usual daily activity and myocardial performance. Option C. The client can be monitored while cardiac conditioning and heart toning are done. Option D. Ischemia can be diagnosed because exercise increases oxygen consumption and demand. The correct answer is option D. Ischemia can be diagnosed because exercise increases oxygen consumption and demand. The correct answer is ischemia can be diagnosed because exercise increases oxygen consumption and demand. Exercise electrocardiography, or stress testing, is designed to elevate the peripheral and myocardial needs for oxygen to evaluate the ability of the myocardium and coronary arteries to meet the additional demands. Question 48. The following medications were noted on review of the client's home medication profile. Which of the medications would most likely potentiate or elevate serum digoxin levels? Here are the options. Option A. KCl. Option B. Thyroid agents. Option C. Quinidine. Option D. Theophylline. The correct answer is option C. Quinidine. The correct answer is quinidine. Quinidine increases digoxin levels dramatically. Question 49. Which of the following statements relevant to a suicidal client is correct? Here are the options. Option A. The more specific a client's plan, the more likely he or she is to attempt suicide. Option B. A client who is unsuccessful at a first suicide attempt is not likely to make future attempts. Option C. A client who threatens suicide is just seeking attention and is not likely to attempt suicide. Option D. Nurses who care for a client who has attempted suicide should not make any reference to the word suicide in order to protect the client's ego. The correct answer is option A. The more specific a client's plan, the more likely he or she is to attempt suicide. The correct answer is the more specific a client's plan, the more likely he or she is to attempt suicide. This is a high risk factor for potential suicide. Question 50. When assessing a child with diabetes insipidus, the nurse should be aware of the cardinal signs of. Here are the options. Option A. Anemia and vomiting. Option B. Polyuria and polydipsia. Option C. Irritability relieved by feeding formula. Option D. Hypothermia and azotemia. The correct answer is option B. Polyuria and polydipsia. The correct answer is polyuria and polydipsia. Polyuria and polydipsia are the cardinal signs of diabetes insipidus. Question 51. The physician orders fluoxetine, Prozac for a depressed client. Which of the following should the nurse remember about fluoxetine? Here are the options. Option A. Because fluoxetine is a tricyclic antidepressant, it may precipitate a hypertensive crisis. Option B. The therapeutic effect of the drug occurs 2 to 4 weeks after treatment is begun. Option C. Foods such as aged cheese, yogurt, soy sauce, and bananas should not be eaten with this drug. Option D. Fluoxetine may be administered safely in combination with monoamine oxidase inhibitors. The correct answer is option B. The therapeutic effect of the drug occurs 2 to 4 weeks after treatment is begun. The correct answer is the therapeutic effect of the drug occurs 2 to 4 weeks after treatment is begun. This statement is true. Question 52. A client with a diagnosis of cervical 4 injury has been stabilized and is ready for discharge. Because this client is at risk for autonomic dysreflexia, he and his family should be instructed to assess for and report. Here are the options. Option A, dizziness and tachypnea. Option B, circumferential pallor and lightheadedness. Option C, headache and facial flushing. Option D, pallor and itching of the face and neck. The correct answer is option C, headache and facial flushing. The correct answer is headache and facial flushing. Autonomic dysreflexia is an uninhibited and exaggerated reflex of the autonomic nervous system to stimulation, which results in vasoconstriction and elevated blood pressure. Question 53. A client with emphysema is placed on diuretics. In order to avoid potassium depletion as a side effect of the drug therapy, which of the following foods should be included in his diet? Here are the options. Option A, celery. Option B, potatoes. Option C, tomatoes. Option D, liver. The correct answer is option B, potatoes. The correct answer is potatoes. Potatoes are high in potassium. Question 54. Which of the following signs and symptoms indicates a tension pneumothorax as compared to an open pneumothorax? Here are the options. Option A, ventilation perfusion mismatch. Option B, hypoxemia and respiratory acidosis. Option C, mediastinal tissue and organ shifting. Option D, decreased ventilation on the affected side. The correct answer is option C, mediastinal tissue and organ shifting. The correct answer is mediastinal tissue and organ shifting. The tension pneumothorax acts like a one-way valve so that the pneumothorax increases with each breath. Eventually, it occupies enough space to shift mediastinal tissue toward the unaffected side away from the midline. Tracheal deviation, movement of point of maximum impulse, and decreased cardiac output will occur. The other three options will occur in both types of pneumothorax. Question 55. A 38-year-old pregnant woman visits her nurse practitioner for her regular prenatal checkup. She is 30 weeks gestation. The nurse should be alert to which condition related to her age? Here are the options. Option A, iron deficiency anemia. Option B, sexually transmitted disease. Option C, intrauterine growth retardation. Option D, pregnancy-induced hypertension. The correct answer is option D, pregnancy-induced hypertension. The correct answer is pregnancy-induced hypertension. Physical risks for the pregnant client older than 35 include increased risk for pregnancy-induced hypertension, cesarean delivery, fetal and neonatal mortality, and trisomy. Question 56. A type 1 diabetic client is diagnosed with cellulitis in his right lower extremity. The nurse would expect which of the following to be present in relation to his blood sugar level? Here are the options. Option A, a normal blood sugar level. Option B, a decreased blood sugar level. Option C, an increased blood sugar level. Option D, fluctuating levels with a predominant increase. The correct answer is option C, an increased blood sugar level. The correct answer is an increased blood sugar level. Hyperglycemia occurs because glucose is produced as the body responds to the stress and illness of cellulitis. Question 57. A laboratory technique specific for diagnosing Lyme disease is. Here are the options. Option A. Polymerase chain reaction. Option B. Heterophil antibody test. Option C. Decrease serum calcium level. Option D. Increase serum potassium level. The correct answer is option A. Polymerase chain reaction. The correct answer is polymerase chain reaction. Polymerase chain reaction is the laboratory technique specific for Lyme disease. Question 58. The cardiac client who exhibits the symptoms of disorientation, lethargy, and seizures may be exhibiting a toxic reaction to. Here are the options. Option A. Digoxin, Lanoxin. Option B. Lidocaine, xylocaine. Option C. Quinidine gluconate or sulfate, quinaglu, quinidex. Option D. Nitroglycerin intravenous, Tridil. The correct answer is option B. Lidocaine, xylocaine. The correct answer is lidocaine, xylocaine. Side effects of lidocaine include heart block, headache, dizziness, confusion, tremor, lethargy, and convulsions. Question 59. A 27-year-old man was diagnosed with type 1 diabetes 3 months ago. 2 weeks ago he complained of pain, redness, and tenderness in his right lower leg. He is admitted to the hospital with a slight elevation of temperature and vague complaints of not feeling well. At 4:30 p.m. on the day of his admission, his blood glucose level is 50 mg. Dinner will be served at 5:00 p.m. The best nursing action would be to. Here are the options. Option A. Give him 3 tablespoons of sugar dissolved in 4 ounces of grape juice to drink. Option B. Ask him to dissolve 3 pieces of hard candy in his mouth. Option C. Have him drink 4 ounces of orange juice. Option D. Monitor him closely until dinner arrives. The correct answer is option C. Have him drink 4 ounces of orange juice. The correct answer is have him drink 4 ounces of orange juice. 4 ounces of orange juice will act immediately to raise the blood sugar to a normal level and sustain it for 30 minutes until supper is served. Question 60. Discharge teaching was effective if the parents of a child with atopic dermatitis could state the importance of. Here are the options. Option A. Maintaining a high humidified environment. Option B. Furry, soft stuffed animals for play. Option C. Showering 3 to 4 times a day. Option D. Wrapping hands in soft cotton gloves. The correct answer is option D. Wrapping hands in soft cotton gloves. The correct answer is wrapping hands in soft cotton gloves. Wrapping hands in soft cotton gloves to prevent skin damage during scratching. Question 61. Which of the following would differentiate acute from chronic respiratory acidosis in the assessment of the trauma client? Here are the options. Option A. Increased partial pressure of carbon dioxide. Option B. Decreased partial pressure of oxygen. Option C. Increased bicarbonate. Option D. Decreased basic S. The correct answer is option C. Increased bicarbonate. The correct answer is increased bicarbonate. Elevation of bicarbonate is a compensatory mechanism in acidosis that occurs almost immediately, but it takes hours to show any effect and days to reach maximum compensation. Renal disease and diuretic therapy may impair the ability of the kidneys to compensate. Question 62. A male client receives 10 units of regular human insulin subcutaneous at 9 p.m. The nurse would expect peak action from this injection to occur at. Here are the options. Option A, 9:30 am. Option B, 10:30 am. Option C, 12 noon. Option D, 4:00 p.m. The correct answer is option C, 12 noon. The correct answer is 12 noon. Regular insulin peak action occurs 2 to 4 hours after administration. Question 63. As the nurse assesses a male adolescent with chlamydia, the nurse determines that a sign of chlamydia is. Here are the options. Option A, enlarged penis. Option B, secondary lymphadenitis. Option C, epididymitis. Option D, hepatomegaly. The correct answer is option C, epididymitis. The correct answer is epididymitis. Untreated chlamydial infection can spread from the urethra, causing epididymitis, which presents as a tender, scrotal swelling. Question 64. One of the most dramatic and serious complications associated with bacterial meningitis is Waterhouse-Friderichsen syndrome, which is. Here are the options. Option A, peripheral circulatory collapse. Option B, syndrome of inappropriate antidiuretic hormone. Option C, cerebral edema resulting in hydrocephalus. Option D, auditory nerve damage resulting in permanent hearing loss. The correct answer is option A, peripheral circulatory collapse. The correct answer is peripheral circulatory collapse. Waterhouse-Friderichsen syndrome is peripheral circulatory collapse, which may result in extensive and diffuse intravascular coagulation and thrombocytopenia resulting in death. Question 65. Priapism may be a sign of. Here are the options. Option A, altered neurological function. Option B, imminent death. Option C, urinary incontinence. Option D, reproductive dysfunction. The correct answer is option A, altered neurological function. The correct answer is altered neurological function. Priapism in the trauma client is due to the neurological dysfunction seen in spinal cord injury. Priapism is an abnormal erection of the penis. It may be accompanied by pain and tenderness. This may disappear as spinal cord edema is relieved. Question 66. The most commonly known vectors of Lyme disease are. Here are the options. Option A, mites. Option B, fleas. Option C, ticks. Option D, mosquitoes. The correct answer is option C, ticks. The correct answer is ticks. Ticks are the common vector of Lyme disease. Question 67. When assessing fetal heart rate status during labor, the monitor displays late decelerations with tachycardia and decreasing variability. What action should the nurse take? Here are the options. Option A, continue monitoring because this is a normal occurrence. Option B, turn client on right side. Option C, decrease intravenous fluids. Option D, report to physician or midwife. The correct answer is option D. Report to physician or midwife. The correct answer is report to physician or midwife. Immediate action is warranted, such as reporting findings, turning mother on left side, administering oxygen, discontinuing oxytocin, pitocin, assessing maternal blood pressure and the labor process, preparing for immediate cesarean delivery, and explaining plan of action to client. Question 68. A child is admitted to the emergency room with her mother. Her mother states that she has been exposed to chickenpox. During the assessment, the nurse would note a characteristic rash. Here are the options. Option A. That is covered with fascicular scabs all in the macular stage. Option B. That appears profusely on the trunk and sparsely on the extremities. Option C. That first appears on the neck and spreads downward. Option D. That appears especially on the cheeks, which gives a slap cheek appearance. The correct answer is option B. That appears profusely on the trunk and sparsely on the extremities. The correct answer is that appears profusely on the trunk and sparsely on the extremities. A rash that appears profusely on the trunk and sparsely on the extremities. Question 69. A client is 6 weeks pregnant. During her first prenatal visit, she asks, how much alcohol is safe to drink during pregnancy? The nurse's response is, here are the options. Option A. Up to 1 ounces daily. Option B. Up to 2 ounces daily. Option C. Up to 4 ounces weekly. Option D. No alcohol. The correct answer is option D. No alcohol. The correct answer is no alcohol. The recommended safe dosage of alcohol consumption during pregnancy is none. Question 70. Which of the following would the nurse expect to find following respiratory assessment of a client with advanced emphysema? Here are the options. Option A. Distant breath sounds. Option B. Increased heart sounds. Option C. Decreased anterior-posterior chest diameter. Option D. Collapsed neck veins. The correct answer is option A. Distant breath sounds. The correct answer is distant breath sounds. Distant breath sounds are found in clients with emphysema owing to increased anterior-posterior chest diameter, overdistension, and air trapping. Question 71. Which of the following would have the physiological effect of decreasing intracranial pressure? Here are the options. Option A. Increased core body temperature. Option B. Decreased serum osmolality. Option C. Administration of hypoosmolar fluids. Option D. Decreased partial pressure of carbon dioxide. The correct answer is option D. Decreased partial pressure of carbon dioxide? The correct answer is decreased partial pressure of carbon dioxide. Hypercapnia and hypoventilation, which cause retention of carbon dioxide and lead to respiratory acidosis, both increase intracranial pressure. Carbon dioxide is the most potent vasodilator known. Question 72. When teaching a mother of a 4-month-old with diarrhea about the importance of preventing dehydration, the nurse would inform the mother about the importance of feeding her child. Here are the options. Option A. Fruit juices. Option B. Diluted carbonated drinks. Option C. Soy-based, lactose-free formula. Option D. Regular formulas mixed with electrolyte solutions. The correct answer is option C. Soy-based, lactose-free formula. The correct answer is soy-based, lactose-free formula. Soy-based, lactose-free formula reduces stool output and duration of diarrhea in most infants. Question 73. The nurse is aware that nutrition is an important aspect of care for a client with hepatitis. Which of the following diets would be most therapeutic? Here are the options. Option A, high protein and low carbohydrate. Option B, low calorie and low protein. Option C, high carbohydrate and high calorie. Option D, low carbohydrate and high calorie. The correct answer is option C, high carbohydrate and high calorie. The correct answer is high carbohydrate and high calorie. Increased carbohydrates provide needed calories. Question 74. A long-term goal for the nurse in planning care for a depressed, suicidal client would be to. Here are the options. Option A, provide him with a safe and structured environment. Option B, assist him to develop more effective coping mechanisms. Option C, have him sign a no-suicide contract. Option D, isolate him from stressful situations that may precipitate a depressive episode. The correct answer is option B, assist him to develop more effective coping mechanisms. The correct answer is assist him to develop more effective coping mechanisms. Long-term therapy should be directed toward assisting the client to cope effectively with stress. Question 75. The primary reason that an increase in heart rate, 100 beats per minute detrimental to the client with a myocardial infarction, MI, is that. Here are the options. Option A, stroke volume and blood pressure will drop proportionately. Option B, systolic ejection time will decrease, thereby decreasing cardiac output. Option C, decreased contractile strength will occur due to decreased filling time. Option D, decreased coronary artery perfusion due to decreased diastolic filling time will occur, which will increase ischemic damage to the myocardium. The correct answer is option D. Decreased coronary artery perfusion due to decreased diastolic filling time will occur, which will increase ischemic damage to the myocardium. The correct answer is decreased coronary artery perfusion due to decreased diastolic filling time will occur, which will increase ischemic damage to the myocardium. Decreased oxygen supply due to decreased time for filling of the coronary arteries increases ischemia and infarct size. Tachycardia primarily robs the heart of diastolic time, which is the primary time for coronary artery filling. Question 76. Which of the following nursing orders should be included in the plan of care for a client with hepatitis C? Here are the options. Option A, the nurse should use universal precautions when obtaining blood samples. Option B, total bed rest should be maintained until the client is asymptomatic. Option C, the client should be instructed to maintain a low semi-Fowler position when eating meals. Option D, the nurse should administer an alcohol back rub at bedtime. The correct answer is option A. The nurse should use universal precautions when obtaining blood samples. The correct answer is the nurse should use universal precautions when obtaining blood samples. The source of infection with hepatitis C is contaminated blood products. Question 77. When inspecting a cardiovascular client, the nurse notes that he needs to sit upright to breathe. This behavior is most indicative of. Here are the options. Option A, pericarditis. Option B, anxiety. Option C, congestive heart failure. Option D, angina. The correct answer is option C, congestive heart failure. The correct answer is congestive heart failure. The inability to oxygenate well without being upright is most indicative of congestive heart failure due to alveolar drowning. Question 78. The physician has ordered that a daily exercise program be instituted by a client with type 1 diabetes following his discharge from the hospital. Discharge instructions about exercise should include which of the following? Here are the options. Option A. Exercise should be performed 30 minutes before meals. Option B. A snack may be needed before and per or during exercise. Option C. Hyperglycemia may occur 2 to 4 hours after exercise. Option D. The blood glucose level should be 100 mg or below before exercise is begun. The correct answer is option B. A snack may be needed before and per or during exercise. The correct answer is a snack may be needed before and per or during exercise. Exercise lowers blood sugar levels. Therefore, a snack may be needed to maintain the appropriate glucose level. Question 79. The nurse notes hyperventilation in a client with a thermal injury. She recognizes that this may be a reaction to which of the following medications if applied in large amounts? Here are the options. Option A. Neosporin sulfate. Option B. Mafenide acetate. Option C. Silver sulfatazine. Option D. Povidone iodine. The correct answer is option B. Mafenide acetate. The correct answer is mafenide acetate. The side effects of mafenide acetate include bone marrow suppression, hemolytic anemia, eosinophilia, and metabolic acidosis. The hyperventilation is a compensatory response to the metabolic acidosis. Question 80. The nurse practitioner determines that a client is approximately 9 weeks gestation. During the visit, the practitioner informs the client about symptoms of physical changes that she will experience during her first trimester, such as, here are the options. Option A. Nausea and vomiting. Option B. Quickening. Option C. A 6 to 8 pounds weight gain. Option D. Abdominal enlargement. The correct answer is option A. Nausea and vomiting. The correct answer is nausea and vomiting. Nausea and vomiting are experienced by almost half of all pregnant women during the first 3 months of pregnancy as a result of elevated human chorionic gonadotropin levels and changed carbohydrate metabolism. Question 81. Which of the following medications requires close observation for bronchospasm in the client with chronic obstructive pulmonary disease or asthma? Here are the options. Option A. Verapamil isopten. Option B. Amrenon Enocker. Option C. Epinephrine adrenaline. Option D. Propranolol Inderal. The correct answer is option D. Propranolol Inderal. The correct answer is propranolol Inderal. Propranolol, esmolol, and labetalol are all blocking agents, which can increase airway resistance and cause bronchospasms. Question 82. Which of the following procedures is necessary to establish a definitive diagnosis of breast cancer? Here are the options. Option A. Diaphanography. Option B. Mammography. Option C. Thermography. Option D. breast tissue biopsy. The correct answer is option D, breast tissue biopsy. The correct answer is breast tissue biopsy. Biopsy, either by needle aspiration or by surgical incision, is the primary diagnostic technique for confirming the presence of cancer cells. Question 83. Pregnant women with diabetes often have problems related to the effectiveness of insulin in controlling their glucose levels during their second half of pregnancy. The nurse teaches the client that this is due to, here are the options. Option A, decreased glomerular filtration and increased tubular absorption. Option B, decreased estrogen levels. Option C, decreased progesterone levels. Option D, increased human placental lactogen levels. The correct answer is option D, increased human placental lactogen levels. The correct answer is increased human placental lactogen levels. Human placental lactogen levels increase later in pregnancy. This hormonal antagonist reduces insulin's effectiveness, stimulates lipolysis, and increases the circulation of free fatty acids. Question 84. A pregnant woman at 36 weeks gestation is followed for pregnancy-induced hypertension and develops proteinuria. To increase protein in her diet, which of the following foods will provide the greatest amount of protein when added to her intake of 100 milliliters of milk? Here are the options. Option A, 50 milliliters light cream and 2 tablespoons corn syrup. Option B, 30 grams powdered skim milk and 1 egg. Option C, 1 small scoop 90g vanilla ice cream and 1 tablespoon chocolate syrup. Option D, 1 package vitamin-fortified gelatin drink. The correct answer is option B, 30 grams powdered skim milk and 1 egg. The correct answer is 30 grams powdered skim milk and 1 egg. Skim milk would add protein. Eggs are good sources of protein while low in fat and calories. Question 85. A 3-year-old child is hospitalized with burns covering her trunk and lower extremities. Which of the following would the nurse use to assess adequacy of fluid resuscitation in the burnt child? Here are the options. Option A, blood pressure. Option B, serum potassium level. Option C, urine output. Option D, pulse rate. The correct answer is option C, urine output. The correct answer is urine output. Urine output, alteration in sensorium, and capillary refill are the most reliable indicators for assessing adequacy of fluid resuscitation. Question 86. A 25-year-old client believes she may be pregnant with her first child. She schedules an obstetric examination with the nurse practitioner to determine the status of her possible pregnancy. Her last menstrual period began May 20, and her estimated date off confinement using Negel's rule is, here are the options. Option A, March 27. Option B, February 1. Option C, February 27. Option D, January 3. The correct answer is option C, February 27. The correct answer is February 27. February 27 is the correct answer. To calculate the estimated date of confinement using Negel's rule, subtract 3 months from the date that the last menstrual cycle began and then add 7 days to the result. Question 87. The medication that best penetrates HR is, here are the options. Option A, mafenite acetate, sulfamylin. Option B, silver sulfate azine, silvadine. Option C, neomycin sulfate, neosporin. Option D, povidone betadine. The correct answer is option A, mafenite acetate, sulfamylin. The correct answer is mafenite acetate, sulfamylin. Mafenite acetate is bacteriostatic against gram-positive and gram-negative organisms and is the agent that best penetrates eschar. Question 88. The therapeutic blood level range for lithium is. Here are the options. Option A, 0.25 to 1.0 milliequivalents per liter. Option B, 0.5 to 1.5 milliequivalents per liter. Option C, 1.0 to 2.0 milliequivalents per liter. Option D, 2.0 to 2.5 milliequivalents per liter. The correct answer is option B, 0.5 to 1.5 milliequivalents per liter. The correct answer is 0.5 to 1.5 milliequivalents per liter. This is the therapeutic range for lithium. Question 89. Which of the following electrocardiography changes would be seen as a positive myocardial stress test response? Here are the options. Option A, hyperacute T wave. Option B, prolongation of the PR interval. Option C, ST segment depression. Option D, pathological Q wave. The correct answer is option C, ST segment depression. The correct answer is ST segment depression. Horizontal ST segment depression of greater than 1 mm during exercise is definitely a positive criterion on the exercise electrocardiography test. Question 90. A psychotic client who believes that he is God and rules all the universe is experiencing which type of delusion? Here are the options. Option A, somatic. Option B, grandiose. Option C, persecutory. Option D, nihilistic. The correct answer is option B, grandiose. The correct answer is grandiose. These delusions are related to feelings of self-importance and uniqueness. Question 91. During burn therapy, morphine is primarily administered intravenous for pain management because this route. Here are the options. Option A, delays absorption to provide continuous pain relief. Option B, facilitates absorption because absorption from muscles is not dependable. Option C, allows for discontinuance of the medication if respiratory depression develops. Option D, avoids causing additional pain from intramuscular injections. The correct answer is option B, facilitates absorption because absorption from muscles is not dependable. The correct answer is facilitates absorption because absorption from muscles is not dependable. Intramuscular injections should not be used until the client is hemodynamically stable and has adequate tissue perfusion. Medications will remain in the subcutaneous tissue with the fluid that is present in the interstitial spaces in the acute phase of the thermal injury. The client will have a poor response to the medication administered, and a dumping of the medication can occur when the medication and fluid are shifted back into the intravascular spaces in the next phase of healing. Question 92. Assessment of the client with pericarditis may reveal which of the following? Here are the options. Option A, ventricular gallop and substernal chest pain. Option B, narrowed pulse pressure and shortness of breath. Option C, pericardial friction rub and pain on deep inspiration. Option D. Pericardial tamponade and widen pulse pressure. The correct answer is option C. Pericardial friction rub and pain on deep inspiration. The correct answer is pericardial friction rub and pain on deep inspiration. The symptoms of pericarditis vary with the cause, but they usually include chest pain, dyspnea, tachycardia, rise in temperature, and friction rub caused by fibrin or other deposits. The pain seen with pericarditis typically worsens with deep inspiration. Question 93. A client who has sustained a basilar skull fracture exhibits blood-tinged drainage from his nose. After establishing a clear airway, administering supplemental oxygen, and establishing intravenous access, the next nursing intervention would be to. Here are the options. Option A. Pass a nasogastric tube through the left nostril. Option B. Place a 4x4 gauze in the nares to impede the flow. Option C. Gently suction the nasal drainage to protect the airway. Option D. Perform a halo test and glucose level on the drainage. The correct answer is option D. Perform a halo test and glucose level on the drainage. The correct answer is perform a halo test and glucose level on the drainage. Testing the fluid from the nares would determine the presence of cerebrospinal fluid. Elevation of the head, notification of the medical staff, and prophylactic antibiotics are appropriate therapy. Question 94. To appropriately monitor therapy and client progress, the nurse should be aware that increased myocardial work and oxygen demand will occur with which of the following? Here are the options. Option A. Positive inotropic therapy. Option B. Negative chronotropic therapy. Option C. Increase in balance of myocardial oxygen supply and demand. Option D. Afterload reduction therapy. The correct answer is option A. Positive inotropic therapy. The correct answer is positive inotropic therapy. Inotropic therapy will increase contractility, which will increase myocardial oxygen demand. Question 95. The most important reason to closely assess circumferential burns at least every hour is that they may result in. Here are the options. Option A. Hypovolemia. Option B. Renal damage. Option C. Ventricular arrhythmias. Option D. Loss of peripheral pulses. The correct answer is option D. Loss of peripheral pulses. The correct answer is loss of peripheral pulses. Full-thickness circumferential burns are non-elastic and result in an internal tourniquet effect that compromises distal blood flow when the area involved is an extremity. Circumferential full-thickness torso burns compromise respiratory motion and, when extreme, cardiac return. Question 96. A pregnant client comes to the office for her first prenatal examination at 10 weeks. She has been pregnant twice before. The first delivery produced a viable baby girl at 39 weeks 3 years ago. The second pregnancy produced a viable baby boy at 36 weeks 2 years ago. Both children are living and well. Using the Gravida term-per-term abortion living system to record her obstetrical history, the nurse should record. Here are the options. Option A. 3-2-2-0-2-0-2-2. Option B. 2-2-2-0-2-2-2. Option C. 3-1-1-2-0-2-2. Option D. 2-1-1-2-0-2-2. The correct answer is option C. 3-1-1-2-0-2-2. The correct answer is 3-1-1-2-0-2-2. This answer is the correct application of gravida-term-per-term abortion living method. The client is currently pregnant for the third time, G=3. Her first pregnancy ended at term greater than 37 weeks, T=1. Her second pregnancy ended per term 20 to 33 weeks, P=1. She has no history of abortion, A=0, and she has 2 living children, L=2. Question 97. A 68-year-old woman is admitted to the hospital with chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. She is started on an aminophylline infusion. 3 days later she is breathing easier. A serum theophylline level is drawn. Which of the following values represents a therapeutic level? Here are the options. Option A, 14 μg per ml. Option B, 25 μg per ml. Option C, 4 μg per ml. Option D, 30 μg per ml. The correct answer is option A, 14 μg per ml. The correct answer is 14 μg per ml. The therapeutic blood level range of theophylline is 10 to 20 mg per ml. Therapeutic drug monitoring determines effective drug dosages and prevents toxicity. Question 98. A nasogastric tube inserted preoperatively is attached to low, intermittent suctions. A client with a nasogastric tube exhibits these symptoms. He is restless. Serum electrolytes are Na 138, K 4.0. Blood pH 7.53. This client is most likely experiencing. Here are the options. Option A, hyperkalemia. Option B, hyponatremia. Option C, metabolic acidosis. Option D, metabolic alkalosis. The correct answer is option D, metabolic alkalosis. The correct answer is metabolic alkalosis. With an nasogastric tube attached to low, intermittent suction, acids are removed and a client will develop metabolic alkalosis. Question 99. A client is in early labor. Her fetus is in a left occiput anterior, LOA position. Fetal heart sounds are best auscultated just. Here are the options. Option A, below the umbilicus toward left side of mother's abdomen. Option B, below the umbilicus toward right side of mother's abdomen. Option C, at the umbilicus. Option D, above the umbilicus to the left side of mother's abdomen. The correct answer is option A, below the umbilicus toward left side of mother's abdomen. The correct answer is below the umbilicus toward left side of mother's abdomen. LOA identifies a fetus whose back is on its mother's left side, whose head is the presenting part, and whose back is toward its mother's anterior. It is easiest to auscultate fetal heart tones, FHTs, through the fetus's back. Question 100. A mother came to the pediatric clinic with her 17-month-old child. The mother would like to begin toilet training. What should the nurse teach her about implementing toilet training? Here are the options. Option A, take 2 or 3 favorite toys with the child. Option B, have a child-sized toilet seat or training potty on hand. Option C, explain to the child she is going to void and defecate. Option D, show disapproval if she does not void or defecate. The correct answer is option B, have a child-sized toilet seat or training potty on hand. The correct answer is have a child-sized toilet seat or training potty on hand. A child-sized toilet seat or a training potty gives a child a feeling of security. Question 101. Which one of the following is considered a reliable indicator for assessing the adequacy of fluid resuscitation in a 3-year-old child who suffered partial and full-thickness burns to 25% of her body? Here are the options. Option A, urine output. Option B, edema. Option C, hypertension. Option D, bulging fontanelle. The correct answer is option A, urine output. The correct answer is urine output. Urinary output is a reliable indicator of renal perfusion, which in turn indicates that fluid resuscitation is adequate. Intravenous fluids are adjusted based on the urinary output of the child during fluid resuscitation. Question 102. The nurse working in a prenatal clinic needs to be alert to the cardinal signs and symptoms of pregnancy-induced hypertension because here are the options. Option A. Immediate treatment of mild pregnancy-induced hypertension includes the administration of a variety of medications. Option B. Psychological counseling is indicated to reduce the emotional stress causing the blood pressure elevation. Option C. Self-discipline is required to control caloric intake throughout the pregnancy. Option D. The client may not recognize the early symptoms of pregnancy-induced hypertension. The correct answer is option D. The client may not recognize the early symptoms of pregnancy-induced hypertension. The correct answer is the client may not recognize the early symptoms of pregnancy-induced hypertension. The client most frequently is not aware of the signs and symptoms in mild pregnancy-induced hypertension. Question 103. A client is admitted to the labor unit. On vaginal examination, the presenting part in a cephalic presentation was at station +2. Station 12 means that the Here are the options. Option A. Presenting part is 2 cm above the level of the ischial spines. Option B. Biparietal diameter is at the level of the ischial spines. Option C. Presenting part is 2 cm below the level of the ischial spines. Option D. Biparietal diameter is 5 cm above the ischial spines. The correct answer is option C. Presenting part is 2 cm below the level of the ischial spines. The correct answer is presenting part is 2 cm below the level of the ischial spines. Station is the relationship of the presenting part to an imaginary line drawn between the ischial spines. If the presenting part is below the ischial spines, the station is positive. Thus, 2 cm below the ischial spines is the station +2. Question 104. To prevent fungal infections of the mouth and throat, the nurse should teach clients on inhaled steroids too. Here are the options. Option A. Rinse the plastic holder that aerosolizes the drug with hydrogen peroxide every other day. Option B. Rinse the mouth and gargle with warm water after each use of the inhaler. Option C. Take antacids immediately before inhalation to neutralize mucous membranes and prevent infection. Option D. Rinse the mouth before each use to eliminate colonization of bacteria. The correct answer is option B. Rinse the mouth and gargle with warm water after each use of the inhaler. The correct answer is rinse the mouth and gargle with warm water after each use of the inhaler. It is important to rinse the mouth after each use to minimize the risk of fungal infections by reducing the droplets of the glucocorticoid left in the oral cavity. Question 105. A 16-year-old client comes to the prenatal clinic for her monthly appointment. She has gained 14 pounds from her 7th to 8th month. Her face and hands indicate edema A. She is diagnosed as having pregnancy-induced hypertension and referred to the high-risk prenatal clinic. The client's weight increase is most likely due to. Here are the options. Option A. Overeating and subsequent obesity. Option B. Obesity prior to conception. Option C. Hypertension due to kidney lesions. Option D. Fluid retention. The correct answer is option D. Fluid retention. The correct answer is fluid retention. The weight gain in pregnancy-induced hypertension is due to the retention of sodium ions and fluid and is one of the 3 cardinal symptoms of pregnancy-induced hypertension. Question 106. A 6-month-old infant has developmental delays. His weight falls below the 5th percentile when plotted on the growth chart. A diagnosis of failure to thrive is made. What behaviors might indicate the possibility of maternal deprivation? Here are the options. Option A. Responsive to touch, wants to be held. Option B. Uncomforted by touch, refuses bottle. Option C. Maintains eye-to-eye contact. Option D. Finicky eater, easily pacified, cuddly. The correct answer is option B. Uncomforted by touch, refuses bottle. The correct answer is uncomforted by touch, refuses bottle. Maternal deprivation behaviors include poor feeding, stiffening and refusal to eat, and inconsistencies in responsiveness. Question 107. The nurse teaches a male client ways to reduce the risks associated with furosemide therapy. Which of the following indicates that he understands this teaching? Here are the options. Option A. I'll be sure to rise slowly and sit for a few minutes after lying down. Option B. I'll be sure to walk at least 2 to 3 blocks every day. Option C. I'll be sure to restrict my fluid intake to 4 or 5 glasses a day. Option D. I'll be sure not to take any more aspirin while I am on this drug. The correct answer is option A. I'll be sure to rise slowly and sit for a few minutes after lying down. The correct answer is I'll be sure to rise slowly and sit for a few minutes after lying down. This response will help to prevent the occurrence of postural hypotension, a common side effect of this drug and a common reason for falls. Question 108. A client is admitted to the hospital for an induction of labor owing to a gestation of 42 weeks confirmed by dates and ultrasound. When she is dilated 3 centimeters, she has a contraction of 70 seconds. She is receiving oxytocin. The nurse's first intervention should be to. Here are the options. Option A. Check FHT. Option B. Notify the attending physician. Option C. Turn off the intravenous oxytocin. Option D. Prepare for the delivery because the client is probably in transition. The correct answer is option C. Turn off the intravenous oxytocin. The correct answer is turn off the intravenous oxytocin. The standard of care for an induction according to the Association of Women's Health, Obstetric, and Neonatal Nurses and American College of Obstetrics and Gynecology is that contractions should not exceed 60 seconds in an induction. Induction should simulate normal labor, 70-second contractions during the latent phase. 3 centimeters are not the norm. The next contractions can be longer and increase risks to the mother and fetus. Question 109. A male client is scheduled for a liver biopsy. In preparing him for this test, the nurse should. Here are the options. Option A. Explain that he will be kept nothing by mouth for 24 hours before the exam. Option B. Practice with him so he will be able to hold his breath for 1 minute. Option C. Explain that he will be receiving a laxative to prevent a distended bowel from applying pressure on the liver. Option D. Explain that his vital signs will be checked frequently after the test. The correct answer is option D. Explain that his vital signs will be checked frequently after the test. The correct answer is explain that his vital signs will be checked frequently after the test. Following the test, the client is watched for hemorrhage and shock. Question 110. After a liver biopsy, the best position for the client is. Here are the options. Option A. High Fowler. Option B. Prone. Option C. Supine. Option D. Right lateral. The correct answer is option D. Right lateral. The correct answer is right lateral. The right lateral position would allow pressure on the liver to prevent bleeding. Question 111. In assisting preconceptual clients, the nurse should teach that the corpus luteum secretes progesterone, which thickens the endometrial lining in which of the phases of the menstrual cycle. Here are the options. Option A. Menstrual phase. Option B. Proliferative phase. Option C. Secretory phase. Option D. Ischemic phase. The correct answer is option C. Secretory phase. The correct answer is secretory phase. The ovarian hormone responsible for the secretory phase is progesterone, which is secreted by the corpus luteum and causes marked swelling in the uterine endometrium. Question 112. A 4-year-old child is being discharged from the hospital after being treated for severe croup. Which one of the following instructions should the nurse give to the child's mother for the home treatment of croup? Here are the options. Option A. Take him in the bathroom, turn on the hot water, and close the door. Option B. Give him a dose of antihistamine. Option C. Give large amounts of clear liquids if drooling occurs. Option D. Place him near a cool mist vaporizer and encourage crying. The correct answer is option A. Take him in the bathroom, turn on the hot water, and close the door. The correct answer is take him in the bathroom, turn on the hot water, and close the door. Initial home treatment of croup includes placing the child in an environment of high humidity to liquefy and mobilize secretions. Question 113. A male client is started on intravenous anticoagulant therapy with heparin. Which of the following laboratory studies will be ordered to monitor the therapeutic effects of heparin? Here are the options. Option A. Partial thromboplastin time. Option B. Hemoglobin. Option C. Red blood cell count. Option D. Prothrombin time. The correct answer is option A. Partial thromboplastin time. The correct answer is partial thromboplastin time. Partial thromboplastin time is used to monitor the effects of heparin, and dosage is adjusted depending on test results. It is a screening test used to detect deficiencies in all plasma clotting factors except factors Roman 7 and Roman 13 and platelets. Question 114. A 16-year-old student has a long history of bronchial asthma and has experienced several severe asthmatic attacks during the school year. The school nurse is required to administer 0.2 milliliters of 1 to 1,000 solution of epinephrine subcutaneous during an asthma attack. How does the school nurse evaluate the effectiveness of this intervention? Here are the options. Option A. Increased pulse rate. Option B. Increased expectorative secretions. Option C. Decreased inspiratory difficulty. Option D. Increased respiratory rate. The correct answer is option C. Decreased inspiratory difficulty. The correct answer is decreased inspiratory difficulty. Epinephrine decreased inspiratory difficulty by stimulating 1 and 2 receptors causing sympathomimetic stimulation, for example bronchodilation. Question 115. Nursing interventions designed to decrease the risk of infection in a client with an indwelling catheter include. Here are the options. Option A. Cleanse area around the meatus twice a day. Option B. Empty the catheter drainage bag at least daily. Option C. Change the catheter tubing and bag every 48 hours. Option D. Maintain fluid intake of 1,002 to 1,000 milliliters every day. The correct answer is option A. Cleanse area around the meatus twice a day. The correct answer is cleanse area around the meatus twice a day. Catheter site care is to be done at least twice daily to prevent pathogen growth at the catheter insertion site. Question 116. A 23-year-old borderline client is admitted to an inpatient psychiatric unit following an impulsive act of self-mutilation. A few hours after admission, she requests special privileges, and when these are not granted, she stands up and angrily shouts that the people on the unit do not care, and she storms across the room. The nurse should respond to this behavior by. Here are the options. Option A. Placing her in seclusion until the behavior is under control. Option B. Walking up to the client and touching her on the arm to get her attention. Option C. Communicating a desire to assist the client to regain control, offering a one-to-one session in a quiet area. Option D. Confronting the client, letting her know the consequences for getting angry and disrupting the unit. The correct answer is option C. Communicating a desire to assist the client to regain control, offering a one-to-one session in a quiet area. The correct answer is communicating a desire to assist the client to regain control, offering a one-to-one session in a quiet area. Client lacks sufficient self-control to limit own maladaptive behavior. She may need assistance from staff. Question 117. A client is being discharged with albuterol, Proventil and beclombethasone dipropionate, Vanserol to be administered via inhalation 3 times a day and at bedtime. Client teaching regarding the sequential order in which the drugs should be administered includes. Here are the options. Option A. Glucocorticoid followed by the bronchodilator. Option B. Bronchodilator followed by the glucocorticoid. Option C. Alternate successive administrations. Option D. According to the client's preference. The correct answer is option B. Bronchodilator followed by the glucocorticoid. The correct answer is bronchodilator followed by the glucocorticoid. Bronchodilating the airways first allows for the glucocorticoid to be inhaled through open airways and increases the penetration of the steroid for maximum effectiveness of the drug. Question 118. A Gravida 2 Para 1 client delivered a full-term newborn 12 hours ago. The nurse finds her uterus to be boggy, high, and deviated to the right. The most appropriate nursing action is to. Here are the options. Option A. Notify the physician. Option B. Place the client on a pad count. Option C. Massage the uterus and reevaluate in 30 minutes. Option D. Have the client void and then reevaluate the fundus. The correct answer is option D. Have the client void and then reevaluate the fundus. The correct answer is have the client void and then reevaluate the fundus. The most common cause of uterine displacement is a full bladder. Question 119. During a client's first postpartum day, the nurse assessed that the fundus was located laterally to the umbilicus. This may be due to, here are the options. Option A. Endometritis. Option B. Fibroid tumor on the uterus. Option C. Displacement due to bowel distension. Option D. Urine retention or a distended bladder. The correct answer is option D. Urine retention or a distended bladder. The correct answer is urine retention or a distended bladder. Urine retention or bladder distension commonly displaces the uterus to the right and may delay involution. Question 120. The nurse instructs a pregnant client, G2P1, to rest in a side-lying position and avoid lying flat on her back. The nurse explains that this is to avoid vena cava syndrome, a condition which, here are the options. Option A. Occurs when blood pressure increases sharply with changes in position. Option B. Results when blood flow from the extremities is blocked or slowed. Option C. Is seen mainly in first pregnancies. Option D. May require medication if positioning does not help. The correct answer is option B. Results when blood flow from the extremities is blocked or slowed. The correct answer is results when blood flow from the extremities is blocked or slowed. Pressure of the gravid uterus on the inferior vena cava decreases blood return from lower extremities. Question 121. The nurse enters the playroom and finds an 8-year-old child having a grand mal seizure. Which one of the following actions should the nurse take? Here are the options. Option A. Place a tongue blade in the child's mouth. Option B. Restrain the child so he will not injure himself. Option C. Go to the nurse's station and call the physician. Option D. Move furniture out of the way and place a blanket under his head. The correct answer is option D. Move furniture out of the way and place a blanket under his head. The correct answer is move furniture out of the way and place a blanket under his head. The nurse should provide safety for the child by moving objects and protecting the head. Question 122. A mother frantically calls the emergency room asking what to do about her 3-year-old girl who was found eating pills out of a bottle in the medicine cabinet. The emergency room nurse tells the mother to, here are the options. Option A. Give the child 15 milliliters of syrup of ipecac. Option B. Give the child 10 milliliters of syrup of ipecac with a sip of water. Option C. Give the child 1 cup of water to induce vomiting. Option D. Bring the child to the emergency room immediately. The correct answer is option D. Bring the child to the emergency room immediately. The correct answer is bring the child to the emergency room immediately. Vomiting should never be induced in an unconscious client because of the risk of aspiration. Question 123. A mother continues to breastfeed her 3-month-old infant. She tells the nurse that over the past 3 days she has not been producing enough milk to satisfy the infant. The nurse advises the mother to do which of the following? Here are the options. Option A. Start the child on solid food. Option B. Nurse the child more frequently during this growth spurt. Option C. Provide supplements for the child between breastfeeding so you will have enough milk. Option D. Wait 4 hours between feedings so that your breasts will fill up. The correct answer is option B. Nurse the child more frequently during this growth spurt. The correct answer is nurse the child more frequently during this growth spurt. Production of milk is supply and demand. A common growth spurt occurs at 3 months of age, and more frequent nursing will increase the milk supply to satisfy the infant. Question 124. A client is being discharged and will continue enteral feedings at home. Which of the following statements by a family member indicates the need for further teaching? Here are the options. Option A. If he develops diarrhea lasting for more than 2 to 3 days, I will contact the doctor or nurse. Option B. I should anticipate that he will gain about 1 pound per day now that he is on continuous feedings. Option C. It is important to keep the head of his bed elevated or sit him in the chair during feedings. Option D. I should use prepared or open formula within 24 hours and store unused portions in the refrigerator. The correct answer is option B. I should anticipate that he will gain about 1 pound per day now that he is on continuous feedings. The correct answer is I should anticipate that he will gain about 1 pound per day now that he is on continuous feedings. A consistent weight gain of more than 0.22 kg per day, 12 pounds per day over several days should be reported promptly. The client should be evaluated for fluid volume excess. Question 125. Which nursing implication is appropriate for a client undergoing a paracentesis? Here are the options. Option A. Have the client void before the procedure. Option B. Keep the client nothing by mouth. Option C. Observe the client for hypertension following the procedure. Option D. Place the client on the right side following the procedure. The correct answer is option A. Have the client void before the procedure. The correct answer is have the client void before the procedure. A full bladder would impede withdrawal of acidic fluid. Question 126. One of the medications that is prescribed for a male client is furosemide, lasts 680 mg twice daily. To reduce his risk of falls, the nurse would teach him to take this medication. Here are the options. Option A. On arising and no later than 6 p.m. Option B. At evenly spaced intervals such as 8 a.m. and 8 p.m. Option C. With at least 1 glass of water per pill. Option D. With breakfast and at bedtime. The correct answer is option A. On arising and no later than 6 p.m. The correct answer is on arising and no later than 6 p.m. This option provides adequate spacing of the medication and will limit the client's need to get up to go to the bathroom during the night hours, when he is especially at high risk for falls. Question 127. The nurse observes that a client has difficulty chewing and swallowing her food. A nursing response designed to reduce this problem would include, here are the options. Option A. Ordering a full liquid diet for her. Option B. Ordering 5 small meals for her. Option C. Ordering a mechanical soft diet for her. Option D. Ordering a pureed diet for her. The correct answer is option C. Ordering a mechanical soft diet for her. The correct answer is ordering a mechanical soft diet for her. A mechanical soft diet should be easier to chew and swallow because foods would be more evenly consistent. Question 128. In performing the initial nursing assessment on a client at the prenatal clinic, the nurse will know that which of the following alterations is abnormal during pregnancy? Here are the options. Option A, stria gravidarum. Option B, closma. Option C, dysuria. Option D, colostrum. The correct answer is option C, dysuria. The correct answer is dysuria. Dysuria is an abnormal danger sign during pregnancy and may indicate a urinary tract infection. Question 129. Assessment of severe depression in a client reveals feelings of hopelessness, worthlessness, inability to feel pleasure, sleep, psychomotor, and nutritional alterations. Delusional thinking, negative view of self, and feelings of abandonment. These clinical features of the client's depression alert the nurse to prioritize problems and care by addressing which of the following problems first. Here are the options. Option A, nutritional status. Option B, impaired thinking. Option C, possible harm to self. Option D, rest and activity impairment. The correct answer is option C, possible harm to self. The correct answer is possible harm to self. Possible harm to self as with suicidal ideation. A suicide plan means to execute plan, and per or overt gestures or an attempt must be addressed as an immediate concern and safety measures implemented appropriate to the risk of suicide. Question 130. The nurse is teaching a mother care of her child's spica cast. The mother states that he complains of itching under the edge of the cast. One non-pharmacological technique the nurse might suggest would be, here are the options. Option A, blowing air under the cast using a hairdryer on cool setting often relieves itching. Option B, slide a ruler under the cast and scratch the area. Option C, guide a towel under and through the cast and move it back and forth to relieve the itch. Option D, gently thump on cast to dislodge dried skin that causes the itching. The correct answer is option A. Blowing air under the cast using a hairdryer on cool setting often relieves itching. The correct answer is blowing air under the cast using a hairdryer on cool setting often relieves itching. Cool air will often relieve pruritus without damaging the cast or irritating the skin. Question 131. A 56-year-old psychiatric inpatient has had recurring episodes of depression and chronic low self-esteem. She feels that her family does not want her around, experiences a sense of helplessness, and has a negative view of herself. To assist the client in focusing on her strengths and positive traits, a strategy used by the nurse would be to. Here are the options. Option A, tell the client to attend all structured activities on the unit. Option B, encourage or direct client to attend activities that offer simple methods to attain success. Option C, increase the client's self-esteem by asking that she make all decisions regarding attendance in group activities. Option D, not allow any dependent behaviors by the client because she must learn independence and will have to ask for any assistance from staff. The correct answer is option B. Encourage or direct client to attend activities that offer simple methods to attain success. The correct answer is encourage or direct client to attend activities that offer simple methods to attain success. Activities that focus on strengths and accomplishments, with uncomplicated tasks, minimize failure and increase self-worth. Question 132. Respiratory function is altered in a 16-year-old asthmatic. Which of the following is the cause of this alteration? Here are the options. Option A. Altered surfactant production. Option B. Paradoxical movements of the chest wall. Option C. Increased airway resistance. Option D. Continuous changes in respiratory rate and depth. The correct answer is option C. Increased airway resistance. The correct answer is increased airway resistance. Asthma is characterized by spasm and constriction of the airways resulting in increased resistance to airflow. Question 133. A 5-year-old child has suffered second-degree thermal burns over 30% of her body. 48 hours after the burn injury, the nurse must begin to monitor the child for which one of the following complications? Here are the options. Option A. Fluid volume deficit. Option B. Fluid volume excess. Option C. Decreased cardiac output. Option D. Severe hypotension. The correct answer is option B. Fluid volume excess. The correct answer is fluid volume excess. 48 hours to 72 hours after the burn injury and fluid resuscitation, capillary permeability is restored and fluid requirements decrease. Interstitial fluid returns rapidly to the vascular compartment, and the nurse must monitor the child for signs and symptoms of hypervolemia. Question 134. Prenatal clients are routinely monitored for early signs of pregnancy-induced hypertension, pregnancy-induced hypertension. For the prenatal client, which of the following blood pressure changes from baseline would be most significant for the nurse to report as indicative of pregnancy-induced hypertension? Here are the options. Option A. 136 per 88 to 144 per 93. Option B. 132 per 78 to 124 per 76. Option C. 114 per 70 to 140 per 88. Option D. 140 per 90 to 148 per 98. The correct answer is option C. 114 per 70 to 140 per 88. The correct answer is 114 per 70 to 140 per 88. The definition of pregnancy-induced hypertension is an increase in systolic blood pressure of 30 millimeters of mercury and per or diastolic blood pressure of 15 millimeters of mercury. These blood pressures reflect a change of 26 millimeters of mercury systolically and 18 millimeters of mercury diastolically. Question 135. An 83-year-old client has been hospitalized following a fall in his home. He has developed a possible fecal impaction. Which of the following assessment findings would be most indicative of a fecal impaction? Here are the options. Option A. Board-like, rigid abdomen. Option B. Loss of the urge to defecate. Option C. Liquid stool. Option D. Abdominal pain. The correct answer is option C. Liquid stool. The correct answer is liquid stool. When an impaction is present, only liquid stool will be able to pass around the impacted site. Question 136. A postpartum client complains of rectal pressure and severe pain in her perineum. This may be indicative of. Here are the options. Option A. Afterbirth pains. Option B. Constipation. Option C. Cystitis. Option D. A hematoma of the vagina or vulva. The correct answer is option D. A hematoma of the vagina or vulva. The correct answer is a hematoma of the vagina or vulva. Hematomas are frequently associated with severe pain and pressure. Further assessments are indicated for this client. Question 137. Iron dextran, imferrin, is a parenteral iron preparation. The nurse should know that it, here are the options. Option A. Is also called intrinsic factor. Option B. Must be given in the abdomen. Option C. Requires use of the Z-track method. Option D. Should be given subcutaneous. The correct answer is option C. Requires use of the Z-track method. The correct answer is requires use of the Z-track method. A Z-track method of injection is required to prevent staining and irritation of the tissue. Question 138. The nurse would be sure to instruct a client on the signs and symptoms of an eye infection and hemorrhage. These signs and symptoms would include, here are the options. Option A. Blurred vision and dizziness. Option B. Eye pain and itching. Option C. Feeling of eye pressure and headache. Option D. Eye discharge and hemoptysis. The correct answer is option B. Eye pain and itching. The correct answer is eye pain and itching. Eye pain is a symptom of hemorrhage within the eye, and itching is associated with infection. Question 139. The nurse is caring for a laboring client. Assessment data include cervical dilation 9 centimeters, contractions every 1 to 2 minutes, strong, large amount of bloody show. The most appropriate nursing goal for this client would be, here are the options. Option A. Maintain client's privacy. Option B. Assist with assessment procedures. Option C. Provide strategies to maintain client control. Option D. Enlist additional caregiver support to ensure client's safety. The correct answer is option C. Provide strategies to maintain client control. The correct answer is provide strategies to maintain client control. This laboring client is in transition, the most difficult part of the first stage of labor because of decreased frequency, increased duration and intensity, and decreased resting phase of the uterine contraction. The client's ability to cope is most threatened during this phase of labor, and nursing actions are directed toward helping the client to maintain control. Question 140. A complication for which the nurse should be alert following a liver biopsy is. Here are the options. Option A. Hepatic coma. Option B. Jaundice. Option C. Ascites. Option D. Shock. The correct answer is option D. Shock. The correct answer is shock. Hemorrhage and shock are the most likely complications after liver biopsy because of already existing bleeding tendencies in the vascular makeup of the liver. Question 141. A 42-year-old client on an inpatient psychiatric unit comments that he was brought to the hospital by his wife because he had taken too many pills and states, "I just couldn't take it anymore." The nurse's best response to this disclosure would be, here are the options. Option A. You shouldn't do things like that. Just tell someone you feel bad. Option B. Tell me more about what you couldn't take anymore. Option C. I'm sure you probably didn't mean to kill yourself. Option D. How long have you been in the hospital? The correct answer is option B. Tell me more about what you couldn't take anymore. The correct answer is tell me more about what you couldn't take anymore. Giving a broad opening gives the client encouragement to continue with verbalization. Question 142. After a 10-year-old child with insulin-dependent diabetes mellitus receives her dinner tray, she tells the nurse that she hates broccoli and wants some corn on the cob. The nurse's appropriate response is, here are the options. Option A. No vegetable exchanges are allowed. Option B. Corn and other starchy vegetables are considered to be bread exchanges. Option C. Yes, you may exchange any vegetable for any other vegetable. Option D. Yes, but only 1/2 ear is allowed. The correct answer is option B. Corn and other starchy vegetables are considered to be bread exchanges. The correct answer is corn and other starchy vegetables are considered to be bread exchanges. The pinch technique is the most effective method for obtaining skin tightness to allow easy entrance of the needle to subcutaneous tissues. Question 143. Which of the following signs might indicate a complication during the labor process with vertex presentation? Here are the options. Option A. Fetal tachycardia to 170 beats per minute during a contraction. Option B. Nausea and vomiting at 8 to 10 centimeters dilation. Option C. Contraction lasting 60 seconds. Option D. Appearance of dark-colored amniotic fluid. The correct answer is option D. Appearance of dark-colored amniotic fluid. The correct answer is appearance of dark-colored amniotic fluid. Passage of meconium in a vertex presentation is a sign of fetal distress. This may be normal in a breech presentation owing to pressure on the presenting part. Question 144. The nurse would be concerned if a client exhibited which of the following symptoms during her postpartum stay? Here are the options. Option A. Pulse rate of 50 to 70 beats per minute by her third postpartum day. Option B. Diuresis by her second or third postpartum day. Option C. Vaginal discharge or rubra, serosa, then rubra. Option D. Diaphoresis by her third postpartum day. The correct answer is option C. Vaginal discharge or rubra, serosa, then rubra. The correct answer is vaginal discharge or rubra, serosa, then rubra. A return of rubra after the serosa period may indicate a postpartum complication. Question 145. Magnesium sulfate blood levels are monitored, and the nurse would be prepared to administer the following antidote for magnesium sulfate side effects or toxicity. Here are the options. Option A. Magnesium oxide. Option B. Calcium hydroxide. Option C. Calcium gluconate. Option D. Naloxone Narcan. The correct answer is option C. Calcium gluconate. The correct answer is calcium gluconate. This drug is the standard antidote and should always be readily available when Mg-SO4 is being administered. Question 146. A mother brings her 3-year-old child who is unconscious but breathing to the emergency room with an apparent drug overdose. The mother found an empty bottle of aspirin next to her child in the bathroom. Which nursing action is the most appropriate? Here are the options. Option A. Put in a nasogastric tube and lavage the child's stomach. Option B. Monitor muscular status. Option C. Teach mother poison prevention techniques. Option D. Place child on respiratory assistance. The correct answer is option A. Put in a nasogastric tube and lavage the child's stomach. The correct answer is put in a nasogastric tube and lavage the child's stomach. The immediate treatment for drug overdose is removal of the drug from the stomach by either forced emesis or gastric lavage. The child's unconscious state prohibits forced emesis. Question 147. Azolfidine, sulfasalazine may be ordered for a client who has ulcerative colitis. Which of the following is a nursing implication for this drug? Here are the options. Option A. Limit fluids to 500 milliliters per day. Option B. Administer 2 hours before meals. Option C. Observe for skin rash and diarrhea. Option D. Monitor blood pressure, pulse. The correct answer is option C. Observe for skin rash and diarrhea. The correct answer is observe for skin rash and diarrhea. Sulfasalazine causes skin rash and diarrhea. Question 148. A dose of theophylline may need to be altered if a client with chronic obstructive pulmonary disease. Here are the options. Option A. Is allergic to morphine. Option B. Has a history of arthritis. Option C. Operates machinery. Option D. Is concurrently on cimetidine for ulcers. The correct answer is option D. Is concurrently on cimetidine for ulcers. The correct answer is concurrently on cimetidine for ulcers. Cimetidine decreases theophylline clearance from the system and increases theophylline levels in the blood, thus increasing the risk of toxicity. Question 149. A 56-year-old client is admitted to the psychiatric unit in a state of total despair. She feels hopeless and worthless, has a flat affect and very sad appearance, and is unable to feel pleasure from anything. Her husband has been assisting her at home with the housework and cooking. However, she has not been eating much, lies around or sits in a chair most of the day, and is becoming confused and thinks her family does not want her around anymore. In assessing the client, the nurse determines that her behavior is consistent with. Here are the options. Option A. Transient depression. Option B. Mild depression. Option C. Moderate depression. Option D. Severe depression. The correct answer is option D. Severe depression. The correct answer is severe depression. Severe depression manifests as feelings of total despair, hopelessness, emptiness, inability to feel pleasure, possibly extreme psychomotor retardation, inattention to hygiene, delusional thinking, confusion, self-blame, and suicidal thoughts. These symptoms are consistent with major depression. Question 150. A client is pregnant with her second child. Her last menstrual period began on January 15. Her expected date of delivery would be. Here are the options. Option A. October 8. Option B. October 15. Option C. October 22. Option D. October 29. The correct answer is option C. October 22. The correct answer is October 22. Correct application of Naegele's rule. Correctly subtracted 3 months and added 7 days.